starting our second day. So good evening and welcome back to the second day of SNO Undergraduate Clinical Research Workshop. Myself, Dr. Kavya, National Membership Coordinator and your moderator for the day. Yesterday you learnt about basics of research, types of studies and manuscript writing by our speaker Isna. Today you will be learning about how to write a case report by Dr. Shivangi. But before introducing her, there are few instructions to be kept in mind. You can ask queries at the end of the session. A feedback form will be provided towards the end, so kindly feel that, because through that only certificates will be provided. And after completion of the workshop, kindly do not leave the WhatsApp group, because the link for the certificates will be provided in that WhatsApp group only later on. So now, without wasting a moment further, let's introduce our speaker, Dr. Shivangi Jha, who has more than 10 publications in various international as well as national journals so far, and a peer reviewer of many journals. Let's delve into the event and learn how to go about for a case report. So Dr. Shivangi, over to you.
Thank you, Kavya, for the introduction. Give me a minute, I'll start.
And one more thing, that we have the recording of the session which will provided to you later on the YouTube. So right now we are live on Facebook as well.
Kavya, please check, is the presentation available?
Yes, it is visible.
Okay. So good evening everyone. Let's go ahead and get a clinical case report published. Table of contents for today are selecting the case, guidelines, title and abstract, introduction, case presentation, and the main structure. Okay, so select an interesting and relevant case. This is the very first part.
The screen is not visible, only blank pages can see.
Okay. Is it now?
Yes.
Okay. So, the key for case reports is select an interesting case and a relevant case at the same time. This is where most of the students make mistake. So, this is the main thing you should keep in mind. Followed by that, choose a unique and clinically significant case that contributes something new to the existing medical literature. If you are going to choose a case which is already there, and if you are going to take a case which is already there with all the information available, it is not going to get published. It could involve rare condition, unexpected presentations, treatment challenges, or even unusual outcomes. Then the second part, review journal guidelines. Before even starting the writing process, thoroughly review the submission guidelines of journal you intend to submit your case report to, and familiarize yourself with their specific requirements regarding formatting, word count, and other essential details. Okay. Then title and abstract. Coming to the main structure of the report, you will start with the title and abstract. Begin by crafting a concise but informative title that accurately describes the essence of your case. Follow it with an abstract. So let me introduce you what an abstract is. It's a brief summary of the case, including its background, objectives, methods, results, and conclusion. And let me tell you a rough word limit for an abstract. It's around 50 to 80 words, not exceeding 80 words for the international journals and not extending 50 words for the national journals. Coming to the next part, that is introduction. Provide a brief introduction to the case, explaining its importance and relevance to clinical practice. Why do you even want to write about this case? It's going to be in the introduction only. Include a concise review of the relevant literature to establish the context and highlight any knowledge gaps your case report addresses to. Followed by that, write about the presentation of the case. Describe the patient demographic information, medical history, presenting symptoms, physical examination, diagnostic tests that were performed, and treatment interventions. Use a chronological order or a logical sequence to present the case comprehensively. Followed by that, in the structure, you are supposed to write a discussion. Analyze and interpret the findings from your case presentation. Compare and contrast your case with similar cases reports in the literature that are already present over the internet, emphasizing the unique aspects of your own case, diagnostic challenges that you have already faced while writing the case or while you were looking at the case, treatment decisions or management strategies employed in your case. Discuss the potential underlying mechanism, prognostic factors, and many more lessons learned from your case. So, in conclusion, summarize the key points of the case and highlight its clinical relevance. Emphasize what makes your case report a valuable one and how it contributes to medical knowledge or patient care. So that's it. That is all the case structure is about. So this is one of the case reports that has been published in One Journal of Vascular Surgeon. I am using as an example of my own case reports. So if you would look at the title, I've just written unusual presentation of left acute upper limb pain. Apart from that, if I would have given it in another title, for example, presentation of left acute upper limb pain or left acute upper limb pain, it would have been halfway there or wouldn't have been published, or why and how it has been an unusual presentation, I have described with the use of an abstract here. So you can see here, in abstract, I have not exceeded the word limit of 80 words here. It was roughly 82 words. Followed by that, there are keywords. So, in order to write keywords, you can use synonyms and you can use some of the words you are going to use in your introduction or in the main content of the case report. After an abstract and keywords, you are supposed to write an introduction. An introduction is not supposed to be of more than 150 words. And as I described earlier, an introduction provides a brief clinical history and how is it relevant to the clinical practice. Include a concise review of the relevant literature to establish the knowledge gaps. So you are going to introduce and write here only why this case is important over many other clinical presentations of the same disease present. In order to make it, for example, if it was a rare condition or there was an unexpected presentation that the physician or the surgeon wasn't looking forward to, followed by write the treatment challenges. And now about the case presentations. So in the case presentation, I have written the brief history first, followed by the demographic details. For example, I have written Sri Krishna Hospital Tertiary Care Center. Then the past history, since it wasn't significant enough, I haven't written. Then what happened when the patient was on admission, followed by the local examination findings. If you could see here. So a picture is worth 1,000 words. Let me justify this. So look at this. I have kept around 5 images here, starting from the clinical image to the pre-op and the post-op images. And in order to make this more effective, you're supposed to make labelings over the images. And coming to the discussion part. Okay. Coming to the discussion part, analyze and interpret your findings. And here in this paragraph, you are supposed to do a compare and contrast of your case with similar case reports in the literature already available. You are supposed to make a contrast, and discussion and the title are one of the main elements of getting your case report published. Followed by that, in the discussion only, you are supposed to write the diagnostic challenges, treatment decisions, management strategies, and other potential underlying mechanisms or the prognostic factor of the disease, or any of the lessons learned while going through this case. Everything has to be here in the discussion part only, and discussion part shouldn't exceed more than 350 words. Coming to the next page, you can see a conclusion here. Conclusion is a very short, like it is going to be a lot shorter than the abstract even. It is going to be half of an abstract. You're supposed to write in the conclusion, hardly in 3 or maximum 5 lines, summarize the key points, like why and how your case report is going to be valuable and how this is going to contribute to your medical knowledge or the patient care further. Because there are many case reports where we come to a dead end. So write about it there only. That is how they are going to accept it. Coming to references, include all the cited references following the specific format required by the journal. Starting from I'll tell you where you should add references. So you're supposed to add references not in the introduction, not in the abstract, not even in the case presentation. Discussion is the only part where you are going to keep references, and for example, I've shown you in the previous part that discussion is where you are going to put references. Do not make mistakes here, because if you are going to put references in the introduction part or in anywhere in the abstract or even in the case presentation, your case report would be rejected at the first place. This is where we all make mistakes, so avoid them. And one more thing, while putting references, do not use references of 1980s or 1970s. Use recent references. As long as you can find a clinical case with the recent references, it is going to work as a literature review as well in the part of the discussion. So make sure that you add references which are relevant to your case and are not more than 5 to 8 years old. Okay, coming to almost the final part and the end of this, proofread and edit. Carefully review your case reports, grammars, syntax, punctuation, and spelling errors. These are where you are going to make mistakes. Use a Grammarly, use more than 3-5 AI softwares available out there, and do a proofread, even if it means proofreading 5 to 10 times before getting this published. Make sure that you are writing it clear, concise, and free from ambiguity. Seek feedback from colleagues or mentors to improve the quality and readability of your report. So there is no harm in getting your colleagues or mentors involved in this and learn from them. Followed by that, let's come to one of the important part. Do not mess up on this. This is obtaining a patient consent. Before submitting your case report, ensure that you have obtained written informed consent from the patient or their legal representative. For example, in case where usually the patient dies, or if the patient is bedridden or is not even in the form he could give you an informed consent or anything, go for a legal representative of the person. Do not mess up on this. Do not fake this. Respect patient's confidentiality and de-identify any personal information in the report. Okay, so whenever you are going to publish the report, there are manuscript checklist. We have something called as manuscript checklist available over the internet in Wiley, PubMed, and even ResearchGate. They give you a manuscript checklist. Do follow the case report manuscript checklist in order to not miss this point. Submission or selection of journal. Follow the submission instructions provided by the journal only. For example, since I was going for a vascular case, I researched about World Journal of Vascular Surgery, right? In a similar way, if you are going for another type of case, go for that type of journal. Prepare the manuscript according to their specified format only and include any additional documents such as cover letter. Cover letter would be signed by your mentor only. So get that cover letter for sure, or even a copyright transfer form. Followed by that, submit your case report through the journal's online submission system only, adhering to their timelines and requirements. Do not miss on timelines and requirements. So for example, there is Indian Journal of Vascular and Endovascular Surgery. It only accepts 5 to 6 cases per year. For a single edition, they publish for 4 times in a year. They hardly take 5 to 6 cases. So here are 2 links I'm going to share with you guys. It's from Wiley and NCBI, that the National Board. Both of them have the manuscript checklist that you should go through first before even starting your case report. In the end, I would like to say thank you and you can ask questions.
Thank you, Dr. Shivangi, for your expert insights over the topic. And so if anyone have any questions, you can ask them in the chat box. We have few anonymous questions, Dr. Shivangi, that in the last reference thing you mentioned about the copyright transfer form or the cover letter. So can you enlighten that? What is that?
Okay, so the copyright transfer form is used in a case when a patient is transformed from one hospital to another. You are not going to get for example, you have a same patient, same case, but the patient gets shifted and it's not under your treatment. So you need a copyright form, and copyright forms are available over Wiley and NCBI or a PubMed even. So you need to keep the copyright form ready and the consent form ready in order to get through this.
Okay. So then if you have to select a proper journal, then how we can select that this journal is authentic and this is not?
Okay. For authentic journals, you need to go for the Google first, okay, and write there how many PubMed indexed journals are there. For example, if you are going for a PLAB or USMLE, you are anyway going to write case reports. So my suggestion would be, if you go to the Google and find list of journals, for example, I've shown you a case of vascular surgery only. So I went for the list of vascular surgery journals. Followed by that, I picked up a journal who is already been affiliated with the PubMed. Okay, so you need to check something known as PubMed indexed.
Okay. Okay. So there is one more question that how we can identify that this case can be used as a case report?
Okay, so First of all, when we are young doctors, you anyway going to see everything as a rare case. Okay, so do not make mistakes of seeing everything as rare. In order to choose a relevant case, the main key is see if there is any unexpected presentation. For example, it was just thrombo TAO, but if there is something unusual about it, if you are going to find something unusual in the treatment part or something you are not able to fit in the box according to the medicine textbooks and all, then you can think about it. Followed by that, if there were treatment challenges following that, or even if there is an unusual outcome, or even there is a rare case. At the end, it's all about getting a rare case.
So a rare case with rare presentation can be accepted?
Yes, it gets.
Okay. So we have one question here from Ritik Savla, that is patient written consent compulsory even if the data is totally unidentifiable, that is fully anonymous?
Okay, I'll tell you a story about this. Right. So I told you, if in case the patient dies, you are anyway not going to get the consent at all, right? So you should go about a relative or somebody who is a guardian of the patient and get the consent from there. And there are some journals who matlab, jahan pe there is no requirement of the consent and all. So you can go for that journal as well. And yes, you are supposed to keep everything anonymous. It's anonymous thing is from your end. Like if I am writing the report, I am supposed to keep everything anonymous about the patient. For example, I did show you an example. In that, I haven't mentioned the name of the patient or anything, not even a hospital number, anything. Just keep that in mind.
Okay, I hope that answers Ritik's question. So we have one more question from Rita, that can a single person write a case report or you need a team? Because she wants to write, but she doesn't have a team.
No, you can write it single-handedly. But I would say prefer a mentor, just a single mentor who is your professor or somebody you can talk to, because for example, I earlier said, as young doctors, sometimes you think it's a rare disease, but it's not. So if you have somebody, at least the one person who is your mentor or anyone, any professor you know who is approachable for you, you can go and do it with him or her.
Yeah. So that answers Rita's question. So that we have few anonymous questions, that if in the starting you have mentioned that in the case presentation, what are the, like you have to mention the clinical symptoms and the treatment, everything, or just the clinical symptoms and investigations? Do we have to mention the treatment portion?
In which part? Case presentation part.
Yes.
Okay. In the presentation part, first of all, start with the demographic details. For example, if I have a case of a 41-year-old female who has been brought from some department to this department. So first of all, inform about the demographic details. Followed by that, prefer writing about if there is no history. There is something called as no history. For example, there is no trauma, fever, cough, headache. It's just a one line. But do not mess up here. Write that line as well. And on admission, now write about when the patient was admitted, whatever you have seen. Followed by that, write examination of the local part, or for example, write inspection, palpation. We all know inspection, palpation. And further, on admission, what you have given them as a treatment. Followed by that, write all the medications. If there was a surgery, do not describe the steps of surgery. Just mention what type of surgery was done. And after that, write a post-op. How is the patient doing now? These are all the things you need to write in a case presentation structure before discussion.
Okay. So in discussion portion, like you have mentioned that we have to write like the few papers, other papers published, we have to reference them and write the discussion. So can you enlighten that how exactly discussion is proceeded?
Okay. So in the part of the discussion, you can start with writing so and so disease is a rare condition. that is difficult to recognize at first. You can start it as a first line. Followed by that, since there are many differential diagnoses, discussion is a place where you could write about the differential diagnosis and how clinical features were presented in your case. After that, this is the opening para, okay? After that, in the second para, you can write how this case was present in another journal or over the literature. Discussion is basically the literature review. Like in research, we do a literature review. In case report, we do a discussion part. So in the discussion part, and reference them as the new ones. As I told you earlier, do not use references older than 8 to 10 years, because it would look like you haven't got through anything new, and it would make a very bad impact for a literature review. As yesterday, Isna has taken the literature review part, I'm not going to describe more. But in the discussion part, write all the things you have done in the case in an elaborative way. For example, for the treatment part, if I was using heparin, so how I have been using heparin in this case, and in another case report, how in this presentation it was used. So describe everything and reference that.
Okay, thank you so much. And we have a question from Sahiti that can we take cases from hospitals that are not affiliated with a medical institution?
Yes, you can. You can.
Okay.
Yeah, you can. Because, for example, if I am an intern in XYZ hospital and the case I have seen is in another ABC hospital, and if I want to write about it, I can. It's not a big issue.
So now we have Adnan's question, that is cover letter and letter to editor-in-chief the same thing?
For some journals it's same, and for some it's not. So when you are going through the process of the guidelines, you can check that. Okay. Few journals just provide a single letter, that is a cover letter. That's it.
Okay. So we have one question that in the reference section, if my case is unique and have no references, then what to do?
Okay. So the example I showed you, it has only 2 references, okay? So it was way too impossible for finding the references I was looking forward to for my case, okay? So I then cited a reference from 1972, right? So in case if you are not going to find any recent reference, like no reference available, just go for a very old reference if you could find. Somewhere in the literature it is going to be there. You need to find a lot of references, and so in case you are not able to find even a single or like 2 references, go for an older one.
Okay, Malab, we have to find at least one, na? Without references.
At least 2 references are required.
Okay. So we have a question from Adnan again, that can you please elaborate on what's cover letter?
Okay, so
sorry to interrupt, but we are sharing the Google Forms link, feedback form link. So while discussing the doubts, you can fill the link. Thank you. Yeah, Dr. Shivani, please continue.
Okay. Just give me a second. If I could get you a cover letter example, I'll share the screen just a minute.
So just a reminder that do not leave the WhatsApp group, because certificates link will be provided on that group only. So please be there.
so I'm unable to find a VA, but I'll tell you the structure of cover letter anyway. So you would write to the editor of that journal, followed by that, introduce yourself in 2-3 lines, and why are you presenting this case within 3-4 lines. Followed by that, write a reference number of your institution's ethical committee if you have taken that institution ethical committee. For example, Indian Journal of Vascular and Endovascular Surgery do require an ethical letter. So there is a letter provided by the journal as well. So you fill that letter, then get it signed by the dean of your college or any higher authority present. For example, the professor's signature also works here. And then reference that letter's number over the cover letter. Followed by that, write a normal like regards and then your name. That's it. And you have obtained the patient's consent and everything.
Okay, I hope that answers Adnan's question. And now we have one question that is ethical committee approval required for every case report?
No. Not for every case report. That's why I told you at the very first part, go for the guidelines of the journal first. In the guidelines only, they describe if they need an ethical letter, cover letter, copyright letter, any kind of letters are supposed to be attached. They are supposed to be written by the journalist. The journal would provide you those structures.
Okay. So if anyone have any question, we'll wait for 1-2 minutes. If anyone have any questions, then you can. Till then, thank you everyone who joined and who participate so beautifully and have so many questions. I hope this helps and clears all your doubt about case report. If everyone can also switch on their cameras, we can take a picture. And if anyone knows how to take a picture. Thank you so much, Akshar. Thank you so much. If you really don't know, please, if anyone knows how to take group photos on Google Meet, please.
It's okay, Kavya, I'm on it.
Okay. Come on, people, turn on your cameras. Let us know when it's done, Dr. Amruta.
Yeah, it's done. You can switch it off.
Thank you so much everyone for joining, and if you have any questions, you have that Dr. Shivangi's email ID. You can contact her and she will guide you further. So thank you so much. Have a great day.
Thank you everyone for joining. Goodbye.